Yes,
Yeah.
okay, you can start now.
Okay. Good evening, everybody. I'm Rupesh Rana. I'm the current president of AIPNO, and this is our last series of the youth initiative, which was first initiated this year to educate our youth AIPNO members and the family, to educate them about the various career possibility, various avenues, and give them armamentarium when they apply for the college level or undergraduate level, that what are the things that is necessary for them. This initiative was started by Dr. Vikas Jain and Dr. Saloni Khatri, and I really want to thank them and congratulate them. Actually, this is their last session of the year. It has been well attended by more than 140 to 145 students every week, and not around the Northeast Ohio region, but people from New York, people from Kansas, people from different other cities who are the part of our research initiative has been joining, and we have got a lot of good feedback. As I said last meeting, this initiative will be next year. We'll work around with the city mayor to use this forum to educate our endogenous kids around the city and make it into a higher state level affair. Today, it's an immense pleasure for me to actually have two speakers. Number one is Dr. Mehboob Rahman. And Dr. Rahman, I was your resident. And Dr. Rahman is the guru of the hypertension, and he's an authority of the hypertension. He has run various trials. He's very well published, and I have learned research from him. So it's always good to have your mentor come back and give the experience to the other mentees. And the second speaker is Dr. Anurag Gupta. He's an associate dean of an executive MBA from the Case Western. Anurag is a very good friend of mine. I think these are the two very well eminent speakers, and I'm very excited to have them join our youth initiative. And thank you for giving your time in the evening at on Sunday. So AIPNO is very grateful and thankful to you. And again, congratulations to Dr. Vikas Jain and Dr. Saloni Khatri for this initiative. And I will give now podium to Dr. Jain.
Thank you, Rupesh. So today our first speaker is Dr. Mehboob Rahman. He is a professor of medicine and vice chair of Department of Medicine Clinical Research at University Hospitals, Case Western Reserve University. He is a renowned nephrologist. He has received many honors and awards. Just to name a few, he was super doctor in Cleveland in 2012 and 13. He was named master clinician by Department of Medicine at Case Western Reserve University, a master clinician in nephrology. He has received many grants, and he is involved in many NIH studies. He is participating in many committees, in national committees, and he is giving editorial services to many journals. He is extremely well published, more than 184 publications and 17 book chapters, and he has trained many fellows and residents. Apart from that, he is a very good tennis player too. So I would like to request Dr. Mehboob Rahman to speak about research opportunities in Greater Cleveland area so that students can benefit.
Thank you very much, Vikas and Rupesh, for that, for those kind words. The only part I'll disagree with is my tennis. You know, it's really borderline. It's not great. But thank you for inviting me to present today. I think this is a great forum that AIPNO has undertaken. So if you can let me share my screen, Vikas, and I can pull up my slides. Okay, it says host disabled participant. So if either Saloni or Vikas, if you guys can allow me to share the screen.
Co-host. You should be able to share your screen now.
Okay. Okay, great. Okay, can you see my screen now?
Yes.
Okay, great, thank you. So as both Vikas and Rupesh mentioned, I'm a professor of medicine at Case Western Reserve University. I'm a nephrologist at University Hospitals and also at the Cleveland VA. I've been here in the UHVA Case Western system for quite a long time, going back over 20 years now. And the clinical research has been a big part of what I've done over the last of my career here at Case Western. Most of my research, as Rupesh mentioned, has been in the area of hypertension, a lot of it in the areas of chronic kidney disease, particularly the link between chronic kidney disease and hypertension. I might talk a little bit about my own research perhaps towards the end, but I have some few introductory slides just to kind of really start the discussion, but I might assigned time, I'll have about at least 15-20 minutes for open discussion. So really be available to answer questions that the audience might have. My introductory slides are really geared towards high school students and undergraduates. So medical students may have to bear with me a little bit as I walk through this, but I'll have plenty of time to answer questions that medical students may have too. And just a comment I'll make is, when we think about research, it's really on biomedical research. And the research can be in many different domains. It can be in engineering, it can be in marketing, finance, really any other area you can do research. And my discussion today is going to focus primarily on biomedical research. So when you think about biomedical research, there are many kinds of research that you can do. Firstly, you can do research in the lab. And this is what most people think about when they think about doing research, is working in a lab where you're doing experiments, where you're testing specific hypothesis in the lab. You may be working with the cell cultures, you may be working with animal models of disease. And here what you're trying to do is to really understand pathophysiology. You're trying to understand what are the mechanisms of disease, what causes what. And here, obviously, in the lab setting, you're very controlled. So you control, what the pH is, for example. You control the setting that you're doing the experiments in. So you have a lot of control in order to test hypotheses in a lab setting. Another domain of research is clinical research, which is really research occurring in the clinical arena, in hospitals, in medical centers typically. And this is research where you're asking clinical questions. So I can give you one example that we did recently. Some of you may be familiar with the SPRINT trial, systolic blood pressure intervention trial. So what we did in this study was across the country, we had about 9,000 patients who were enrolled in the study. We randomly assigned half of the patients to get very tight blood pressure control, and the other half to get what we would call standard blood pressure control, and people forward over time, and showed that really the people who were assigned to intensive blood pressure therapy did much better. And that really has resulted in a change in practice. Now the current guidelines recommend more intensive blood pressure control for most patients. So here's an example of clinical research that you did in the clinical setting, and your research impacted practice. And third type of research is what I would describe as health services or outcomes research, which is equally important. And for example, here you might ask the question, you might look at health disparities. When disparities by race, ethnicity, gender, how do those differences manifest? Just continuing the example of hypertension that I'm most familiar with, there are many differences and disparities in control of blood pressure. If you look at hypertension in African-American patients, blood pressure is less well controlled. It's often more difficult to control. So now you're trying to study really more what the outcomes are in these patients. You're trying to study mechanisms of delivery of healthcare. Is healthcare plan A better than plan B? Equally important research, but different type of research that under the domain of health services and outcomes research. And the last is what I would define as public health research. And here you're really looking at a very high level. This is work that the CDC would do, for example, when they go out and they measure large samples of populations, they collect data, they kind of give you report cards. Again, continuing the hypertension example, the CDC, for example, would tell us every year, what % of patients are controlled to different levels of blood pressure. So you can see that research can be in the healthcare arena, can be of very different types, whether it's lab or clinical research, health services or public health research. But I think it's important to appreciate that all of this are important components of the healthcare domain. Let's take the example of COVID-19 that we're all struggling with now. So there's a lot of work going on in the lab to try to understand how does COVID-19 actually, at a molecular level, infect the person? How does it impact the cellular mechanisms? How does it result in pulmonary kidney disease that happens? That's an example of lab-based research. Clinical research is where we're, when you think about vaccines, there are going to be large vaccine trials that are already undergoing. Some of those at our institution. So we're actually testing the vaccine in patients. When health services, we've all heard about disparities in COVID-19. What are the factors that contribute to those disparities? And lastly, but not least, public health perspective. These are public health decisions that our officials are making about what kind of precautions to take, and this is based on data that public health researchers have generated. So you can see across the spectrum of, regardless of what type of research is done, our goal is to get better health for the populations that we serve. So let's talk a little bit about career paths. Again, this is focused a little bit towards younger audience, maybe high schoolers or undergrads. So if you want biomedical research to be a part of what you do, there are basically two pathways that you can go choose. You can go through medical school and become a physician scientist, and where research is a big part of what you do, in addition to taking care of patients and teaching and many other aspects that you have. But here you combine the roles of being a physician and providing all the physician services that a physician would provide, and also doing research. And I think our own president, Dr. Raina, is a great example of this. He has a terrific practice, a very busy clinician, but does very good research that's published in top class journals. So he might be a really good example of how you can be an MD and also do good research. Another path that you can take is really not a clinical path. Instead of going through an MD, you would actually go through a PhD program. And here you would essentially focus entirely on research and teaching. You would not have the clinical components of it. Many PhDs work in the university setting. Many PhDs work in the industry setting and contribute to development of new therapies and so forth. So this is something that you might want to think about and then talk to people about as to which path works out the best for you with regard to your long-term goals and desires. So let's talk more then about the research opportunities in the Northeast Ohio. And we are really fortunate to live in a wonderful atmosphere for healthcare research. And I think the first one to mention obviously would be the medical school at Case Western Reserve University. So Case has it's an research intensive university. There are a whole spectrum of research programs that go on within the university, ranging from the entire spectrum of research that we talked about. And the research at the university is done in conjunction with the hospitals. So my own institution, University Hospitals, is a vibrant research institution. As you can imagine, since it's a hospital, more of the research here is clinical research, and a large number of clinical trials. Again, using the example of COVID-19, a large number of studies have recently been done, started using COVID-19 to look at new therapies for COVID-19, to look at now vaccines for COVID-19. There's a lot of clinical research going on at university hospitals. Cancer is a big focus at university hospitals. They're top-class cancer researchers. Cardiology is a big focus. Infectious disease. If you think about HIV/AIDS, if you think about tuberculosis, there's a very, very strong research program in infectious disease based here at UH. The VA is really a good resource for research and obviously patient care also. The VA is particularly interested in outcomes research, looking at how different delivery patterns improve care. There's a unique resource in the VA, which is rehabilitation research. There are devices that often do programs that are looking at devices that help people recover from injuries, recover from strokes. A very active rehab program based at the VA. Metro Health, also an important research or institution. Again, the Institute for Public Health is based at Metro Health. My colleague, Dr. Sehgal, leads the Center for Reducing Health Disparities, which is based at Metro Health Medical Center. So the opportunity is there too. Last but not least, obviously the Cleveland Clinic has a vibrant research program. They have the Learn and Research Institute, and many other programs that go on there. Very strong, very strength in cardiology research, but many other domains. So we really are fortunate to have these excellent healthcare institutions, each of which has a vibrant research portfolio in Northeast Ohio. And Northeast Ohio Medical University, certainly Dr. Reina leads a lot of work there. My friend, Dr. Tariq Haki, does top-class research in rheumatology based out of Northeastern Ohio Medical University. So really some really good research going on there too. So how should you get involved in research? What is the process kind of to walk through a little bit? And one of the first things that you have to do is to find someone, find a faculty member who's working in the area that you're interested in, and then how do you link up with the researcher? There are many ways that you can start. I think asking your teachers, if you're in high school, certainly if you're an undergraduate or in medical school, ask your advisors. They know the people who are working in the system, particularly if you're in medical school. At Case Western, there's a system of society deans who are your mentors. They are great resources for you to talk to people. I'm sure there's an equivalent mentoring program at NeoMed that you can talk to people, and they can at least point you in the direction of which person that you might want to address. Look carefully through websites of the institutions that I talked about. There's so much information on the websites of each of these institutions. Most of them have dedicated pages and of their websites that they dedicate to research. So you might want to read through that and see what information you can get. There are programs that are specifically in place to facilitate student researchers. And for example, again, at Case Western, since I'm here, there's a program called Source, and here's the website. You can go there and they'll talk to you about ways that at high school, even at high school level, you can get engaged in research programs. I think networking is an important component. I think here AIPNO, I think, has an important role in getting to know people who work in the area that you're interested in. And I think perhaps offline we can talk about with Rupesh and Vikas and others, how perhaps we can, within AIPNO, develop a list of researchers who would be interested or available to have students come and work with them throughout Northeast Ohio. I think that's certainly something that's feasible, and I'd be happy to help you set that up. But I think simply talking to people who are familiar with the areas is an important step. So what do you do then? What are the next steps? I think it's important that you quote unquote research the researcher. What I mean here is that before you contact someone, you have to know a little bit about what they're doing, what kind of work they're involved in, how productive they are, have they worked with trainees before, what has their experience been. So the easiest way to start would be to do a PubMed search, where you're essentially searching for articles that the researcher has written recently. You can get a sense for, is this someone who's publishing regularly? They published many papers in the last few years, or is this someone who published 10 years back, they're not very active recently? So just simply doing a PubMed search can help you. Then you also want to know about the kind of work that they have done recently, about the field that they're working in. If they're working on, say, prostate cancer, so what's going on in prostate cancer? What is the work that this particular investigator done? How has that contributed to the field? So you understand about the field a little bit also before you actually even reach out to the researcher. So when you actually reach out, then you want to be a little bit specific. So what I mean is that let's say that you're interested in this prostate cancer work, and perhaps this is the next steps that you are available and interested in. Some maybe a little bit about your skills, particularly this applies to maybe medical students or senior undergraduate students. If you're good with the statistics, that's often very helpful. So you can bring that to the table. If you've done some form of data collection, data analysis before, put that in your email, the contact of the researcher. What your timelines are. This is very important because as students, as people who are applying for medical school or for residencies, you have a finite timeline. So by this time in July of next year, you need to have certain things done so that you can put that on your application for residency or medical school. So you have to direct that timeline. The researchers have their own timeline, so you want to make sure that there is some consistency in what you're trying to accomplish. And if you join a great project, but it's going to take 5 years to get done, that's not going to really help you a whole lot. Because at the end of the day, you want to be able to show, what did you do in your research? And it's often best if you're able to put a publication out. You don't have to be the first author, but somewhere that the work that you did resulted in a publication. That's really the goal. But that doesn't happen in all cases. But there's other ways, in abstracts and other ways that you can show that what you did was actually, presented and people actually benefited from that. You also have to know that you may have to contact several researchers. It may, very often you may send emails and simply people haven't responded, or you may people may say, I'm too busy. I can't take any more students. There may be a lot of back and forth that goes on. So I would not be disappointed if researchers say that they can't take you on for one reason. You have to keep going. And it's very likely that you will find among the strength of and diversity of research infrastructure that we have, that you will find someone to help you. Last but not least, most of these positions are unpaid. So you have to remember that you will be spending time. Sometimes student and faculty will have grants that they'll be able to pay you from, but the vast majority of the times these are not paid positions that you'll have to put in your time and effort. But in the end, I think it's really well worth effort. So that's really all I have in terms of general discussions. I'd be happy to take any questions. Vikas and Rupesh, I don't know how you want to do this. Either you can ask directly or put it in the chat, or I'm certainly open to taking any questions.
So Dr. Rahman, I'll just ask directly. This is Rupesh. I'm getting a lot of questions.
Okay.
So we have the same councils that work with the research in NeoMed and lately been involved. So the question that I have is, and this is like 3 or 4 students giving me all together. First of all, I want to congratulate. This is the maximum attendance for all the 3 youth conference. And people from all over the states, from New York, Kansas, everybody has joined. So they are very frustrated. They go and work in the lab for 2 months. And when they come out, they just can write in their CV that they have done the work in the lab and there is no publication. On the other hand, if they get a PubMed indexed article, does that increase their chances? Because when they go and compete with the other students, they have major publication, and these people couldn't be able to explain what they have done for 2 months in the research lab. So that's why the clinical translational research is very important.
Yeah, no, I think that's a great question, Rupesh. And in fact, that's what I meant when I said timeline. So even before you start a research project, you want to say, okay, this is how much time I have. I have 3 months to work on. Is there a specific project that I can get done that will either be published or be, or an abstract or something that I can show that work was done. So if you spend 3 months in a lab and nothing comes out of it, I'm not sure that'll really help you in your application process. So you have to be careful again when you think about that. So it certainly be something to talk about as research experience, but your goal, particularly when you're starting a project, is to critically look and ask the question to say, what's the likelihood that this project is going to result in either a paper, which is ideal, or at least an abstract that I can put on my CV and show that research was done? So that's a question you have to ask upfront.
Thank you, Dr. Rahman. I have another question. The students are moving from basic science to the clinical research. Do you think in the upcoming years, clinical research or the transitional research is a way to go?
Yeah, no, that's another great question. I can tell you over the course of my own career, clinical research, epidemiology, health services research has gained a lot more traction than it did 20 years back. So in 20 years back, if you look at NIH funding, the vast majority of NIH funding would go to basic science labs. Only a small proportion would go to clinical research. And over time, that proportion it's still more in favor of basic science, but there is more and more opportunity for clinical research. And with the new technologies, with using big data for research, which I really didn't talk about, newer technologies of genomics and proteomics, where it's not really working in the lab, it's really more clinical research. So the opportunities are going to be tremendous, I think, in growth of clinical and newer technology and research.
Thank you, Dr. Rahman. I have another question. What possible research is available remotely which could be done by high school students? And this is coming out from out of state.
Yeah, no, again, there is certainly research that you can do remotely. For example, that domain might fit more with what I would call health services research, where, for example, you're doing a survey. You're just doing a survey among patients, you're doing a survey among physicians. You don't necessarily need to be hands-on in a lab doing experiments. That type of project you can do remotely. If you're working on data analysis, which is why I think that people who have some degree of statistical knowledge will be really, really helpful. So in your undergraduate work, if you can choose to take some courses in biostatistics, it'll be very helpful for you in your research. So for example, if there's a data set that's already collected, it's sitting in someone's computer, and you come then to analyze that data, that's a really good way of getting a publication out, and that's certainly something that you could do remotely. So, and I would encourage particularly medical students and youngsters to really look for that type of project where the data is already collected and you're doing the analysis, because it's much more likely to move faster and result in an abstract or a publication, rather than a project that you're starting to collect data on your own.
I have a lot of questions for you, Dr. Rahman, but I'll take this one because this is very important question, comes in a research council. Is there any form of training necessary for doing a clinical trials? It sounds very hectic when you look into the trial. Is it easy to execute for the people who are going into the medical school or doing it?
No, actually, I'm really glad that you asked that question. So there's a lot of rigor that goes into clinical trials. So if you read a clinical trial, certainly in the high-profile clinical trial like like JAMA or New England Journal, I can give you the example of the study we did most recently, which is a SPRINT trial. The SPRINT trial, it cost about $200 million in taxpayer dollars to do. And the reason it's so expensive is the amount of rigor that goes into it. So you have to be very careful in writing how you're going to select the patients, very careful in writing how the intervention is going to be, very careful in designing the study. So in someone who's interested in pursuing really clinical trials, clinical research as a serious part of their profession, really should seriously consider doing a master's degree in epidemiology, master's in public health, and one of those domains. Typically, this might be either during medical school or even after medical school during residency or fellowship training. And that would give you the extra set of skills that you could then say, I'm going to be the principal investigator of a large clinical trial. Because it's beyond sort of patient care. There's a skill set that you need to do large clinical trials.
I will take another question. I know we have another speaker, but I think we'll have another speaker at 7:35. I have a lot of things coming on. Some of the people are asking in the high school, they can do a clinical trial. So I'll skip that. This is a very good question, Dr. Rahman. I like the question. It's coming from the medical student.
Okay.
A NeoMed. And also it's kind of same has been echoed by the case medical student. They're asking, how do you balance the clinical work with the clinical trials and clinical studies? Are you happy balancing between your clinical work and clinical trials?
Fantastic question. I think personally I do. I love it. This is what I enjoy doing. I love taking care of patients, and when I'm taking care of patients when I'm in clinical service, I hope I do it as well as my clinical colleagues do. But I think what my research hat allows me to do is to really extend beyond individual patients to larger populations, to have an impact on what the healthcare is at a larger level. Again, the example of SPRINT trial that I quoted, we spent almost 7 years working on SPRINT. As a result of that, now the guidelines have changed. So you had an impact in a small way on large volume of the entire, essentially, a lot of patients get affected, getting the help, getting improved healthcare. And that kind of gratification is really, really what keeps me driving, what keeps me going. In terms of keeping things balanced, it's a challenge, no two ways about it. Your patients are not going to care if you have a grant that's due. Your grant deadline doesn't go away if your patient is sick. So you do have to be able to balance both. There are a lot of nights and weekends that you spend in this kind of work. But at the end of the day, it's worth every minute.
Thank you, Dr. Rahman. I think we have around 25 questions. Send it to me privately. So I'll try to answer them. If I have, I'll get back to you again.
Sounds good to me.
And I will move the platform to Dr. Khatri.
Yeah, I'll stop sharing the screen now.
Okay, yeah. So our next speaker is Dr. Anurag Gupta. And it's an honor to introduce to Dr. Anurag Gupta. Dr. Gupta is H. Clark Ford Professor of Banking and Finance at Weatherhead School of Management at Case Western Reserve University in Cleveland, Ohio. He has had previously held like various numerous administrative positions, including Vice Dean, Senior Associate Dean, and Chair of Banking and Finance Department at Weatherhead. He started an MS Finance program for Case in Shanghai, China, that he continues to manage as faculty director. His research work has been published in top finance journals, and he has presented his research at also numerous renowned institutions and conferences all over the world. He received his PhD from Stern School of Business, NYU, and did his MBA from IIM in Calcutta. And then he also, bachelor's he did in chemical engineering from IIT Delhi. And prior to PhD, he worked as a full-time management consultant. And since then, he has consulted for many large financial institutions and companies. We are very fortunate to have Dr. Gupta speak to our youth. Welcome, Dr. Gupta.
Thanks a lot, Saloni, and thanks Rupesh and Vikas for inviting me. I'm going to share some thoughts on business education, which is an area where I've been in for a very long time now. I completed my own MBA in '92, so it's been a long road. I have just a single slide, so if you could show that slide, I'll use just that one slide to anchor my comments, and then have to have or anyone else might have. So in terms of business education, I think one of the things I see really often is if it is an MBA or a master's program or something, these are programs which are, in my experience, relatively less understood by people outside the business world. So often people enter into a program without really understanding what the program is about. So I have a little bit of information which I want to share about from a very high level perspective as to how these business programs are conducted. The second part of my conversation is going to be about the kinds of different programs which exist out there, how they are different from each other, who they are suitable for, and how can they help you. So that's how I'm going to structure my comments. Now, an MBA in particular, but in general, MS programs in business are sort of very unique and very different from a master's program in any other discipline. Because if you look at any other discipline, they are very specialized programs. They go in depth into a particular area. An MBA is sort of the complete opposite of that, because it's probably the most broad-based master's degree which exists out there. You have exposure to different areas in management. You'll have classmates who come from varied backgrounds of all kinds. It's probably the most broad kind of a degree you can ever imagine. In general, what an MBA program, or to some extent a master's program, aims to do is to help you do three things really well. And those are the three things I have outlined on the slide. The first one is, of course, about resources, and resources is a word I'm using in a very broad way. So you go through various courses and get exposed to various techniques and models and strategies in managing accounts and finances, operations, etc. And that's a key part of any MBA program, or even most of the shorter master's programs, even in healthcare management, for example, have courses in those areas. That's about resources, and that's point number one. Second point, which is really emphasized across the board in management programs, is helping people think about strategy. And again, I'm using strategy in a very broad way. By strategy, I mean, it could be across a range of organizations. You could be in a nonprofit environment, you could be in a hospital system, you could be in a company, you could be in a bank, you could be in a law firm, consulting firm, anything. A lot of these elements are still needed at some point. Elements in marketing. strategy, overall economics, and all of those are also courses you do as part of a master's program in management. The third and equally important part of your exposure as part of either a one-year program or a two-year program in management is around leadership, is about interacting with human resources and people. So you obviously have a lot of elements of leadership which you are exposed to, I hope in a very experiential way, at least in our school at Case Western, it's quite experiential. And then you have elements of human resources, legal systems, etc., which are also equally important. So sort of resources, strategy, and people. These are the three cornerstones of what makes a good MBA program or a good program in management. All of these are a ton of skills and core skills. So in any management program, you're going to do courses in analytics, statistics, econometrics, etc., depending on the program. And those are essential. I mean, you've got to have strong skills in managing, understanding, handling, and dealing with actually data these days. It doesn't matter what you're doing. Second thing is information systems, again, defined broadly from a systems perspective, and also often from actually a coding perspective. And it also depends on the program. A relatively newer thing where actually we are one of the leading schools at Case Western, we are one of the leading B schools in the world, is in the area of artificial intelligence, AI, and AI as applied to business. And again, as we see now for some years, it's invading everything. It's sort of affecting every way in which organizations are run and business is done. It could be in banks, it could be in investment institutions, it could be in pharmaceutical companies, hospitals, nonprofit organizations, it could be in HR, interviewing people, or anything at all. And so I think those are core skills. And if you have a good mix of courses across these areas from a good set of instructors in a good school, I think you have identified a good program. So that's a very high level, 30,000 feet view of what business education sort of entails. And as you can see, it's broad. It's broad, so you see people with wide range of experiences and backgrounds who come into a business program, into an MBA or a master's program in management, across industries, across experiences. And that's a part of the richness of that experience as well, because you will not interact with a broader set of individuals anywhere else in a program as you would do in business education. In general, I mean, and again, I'm sort of really distilling it to some key points here. In general, there are sort of three kinds of business programs at the master's level, which are out there. And they've been out there for a long time. It's not new. The content, of course, hopefully evolves over time. You have sort of the standard MBA that has existed for 50 years or more. In the US, it's mostly a 2-year MBA. In other parts of the world, it's often a 1-year MBA as well. Usually, most of these MBA programs look for people who have 3, 4, or 5 years experience. Some may have a little bit less, some may have a little bit more. These are individuals who may have experience across a range of industries who come in to essentially reset what they're doing. And then they go out and do whatever they want to do. Sometimes they stick to the industry they came from, but in more cases, they sort of realize what they want to do in life. And then they go on and join, companies and banks and financial institutions and nonprofits and others as well. And that's a standard MBA. For about 30, 35 years or so, executive MBA has become a very popular actually product. And I think it's a really good product. I used to run the executive MBA at Case Western until recently as well. EMBA is for senior executives. By senior, I mean usually we and most schools would like to see people with at least 15 years experience. Often you'll see people with 15 to 30 years experience who are in an executive MBA program. So these are really senior executives who are either at what is known as actually a C-suite level. C-suite means you have a 3-digit acronym starting with C in front of your name. COO, CFO, CMO, CROs, whatever. So either they are at that level or they're about to hit that level. And so these are people with a wealth of experience from a range of industries who come in, who go through a similar kind of an MBA exposure, which includes all the elements I have listed above. But of course, because the audience is senior, the way the content is structured is obviously more for that senior audience. And their goal is, they have already achieved quite a bit in their life, in their main domain. They are either already in a senior leadership role or they're about to reach a senior leadership role. And that's when things converge. So when you start becoming senior and senior and senior, your job roles become similar and similar. You all need to manage resources and budgets and finances and operations. You all have a say in strategy. You all need to look out there in the world and see what's going on in the global and macro scene. You are leading a team or large groups of individuals. So leadership becomes extremely critical. And then since you are leading people, those individuals may be handling a lot of systems. You can't be somebody who doesn't know anything about that. Because in that case, you really won't be able to understand what they are showing you. So you also need some skill set in analytics and information systems and AI and some of the other areas. So the EMBA is sort of on that kind of track. And then you have the third kind of programs. These are shorter MS programs. These are master's programs. Of course, there is a master's program in healthcare management as well. We have that at Case Western as well in Weatherhead. These are usually 9 months to 11 months to sometimes a year and a half. It varies on the program. And these are more geared towards sort of very early career individuals. Sometimes probably half the audience has no experience after undergrad. So they do their undergrad school and come straight into a master's program. They may have a year or two of experience. In most cases, not more than that. They are narrower, shorter, more targeted. So as an example, if you talk about a master's in healthcare management, you can do it in 9 months or in 15 months or in 2 years, depending upon how intense you want it to be. You'll do a little bit of accounting, finance, operations, and marketing, strategy, economics, some leadership, and then you'll have some specific courses on health informatics, statistics, health information systems, AI, and on those kind of courses. And your econ class and finance class will be more sort of concentrated towards the healthcare industry with more examples and case studies from healthcare. And that is what is typically a shorter master's program in business or in healthcare management. Now, a few things to highlight. A business education is a very, very contextual learning environment. Now, what do I mean by that? And I'm somebody who did my undergrad in engineering, and as used to be the case in those years, in an algorithmic way, you take the exam and then you go for your MBA, zero experience, and you end up in your MBA, you do all your courses and get good GPA and grades. But I hadn't worked a day in my life when I did my MBA. I hadn't worked, I'd done some internships, but internships are internships. You don't do much, frankly. I hadn't worked one day in my life full time before my MBA. And I graduated with my MBA. I thought I knew the world. I mean, I was confident, probably arrogant. I thought I knew a lot. I had done well. I went into consulting, started my job, and it took me less than a week to realize how much I didn't know. And then over the years, as I've worked in the industry, you realize that because business education deals with business, with management, if you really haven't intersected with those issues in your life before in a meaningful way, when you're in the classroom, it's all just assignments, quizzes, exams. It's very hard to make sense out of it or relate to it, and very little sticks from a learning perspective. And that's why my advice to everybody always is not to do what I did and to really spend at least a couple of years, go work somewhere, and then get into a management program. because you will know what you want and you will learn a lot more from that program as well. The last thing I'll say is about MBA and master's programs. I've seen in applicants a rush to say, okay, I want to do an MBA, I want to do a master's program, I want to do this. They really often don't step back to ask the question, why do you want to do it? How will it help you? And the kind of job that you want to do in the next 5 or 10 or 15 years, will this MS program in healthcare management or an MBA, will it really increase your competencies in that job, or it's not something that's going to help you at all? So, of course, I have my own opinion on this and people may differ from me, but let me take an example of actually a physician. We have a lot of physicians in our executive MBA program, and very senior ones, and I think it's an outstanding product for them, and I love having them in the program because they really have spent years and are in managerial roles and they understand what's going on. But if you are an early career physician, you are a physician first and foremost, and you probably have not intersected with much of these roles at all. Your job probably for a long time is not going to be related to any of these things at all. So even if you come in, along with your MD or something else, or in between your undergrad or something, and you do a MS program or an MBA, it's really not going to stick. And that's why, because you either are a physician or about to be a physician or want to be a physician, as an example. And now it's actually a different story if you want to be in pharma industry. If you want to be in the corporate world, say in pharma, then of course it's a corporate world. So all of these things and skills are going to really help you a lot. And so you really need to be clear on what your actual job is going to be. If you're a researcher, you're doing research in sciences, in medicine, and in all of these areas, you may at some point you will have a team, but it will be a long time before you're going to be intersecting with some of these issues. And your future and how high you go is going to be determined by the quality of your research and not by how much of accounting and finance or strategy or marketing you know. So I think that's important to keep in mind, because unlike a corporate audience where from day one in your job, these skills are really important, in most of the scientific research and medical research and in medical areas, these are skills you need 10, 15, 20 years later. Advice often to people is to decide what they want to do. And then if this is the path they are on, once they gain sufficient experience, to probably look at an executive MBA as a really good product later on. The standard MBA, we do get some are physicians and other people sometimes. And I think most of them, sometimes they come because they, for whatever reason, want to change paths. So we have actually a physician who wants to join the industry, who wants to be in pharma industry for whatever reason. Now that's a corporate environment, and I can understand the role of an MBA there. But if you have a cardiologist who comes and will be a cardiologist, I'm not sure if in the early stage is going to be all that much of a useful experience. So I'm going to be, I don't want to go on speaking for too long. I'd rather respond to questions and what may be on your mind so that it's more useful for you. So I'll stop here, and I'm happy to sort of respond to any questions or thoughts you might have.
So, Dr. Gupta, this is Rupesh. Thank you. I know you have been traveling internationally and with your time zone. Thank you for joining us.
It's a pleasure. Thank you.
And so I have, first of all, let me ask the question with the curriculum that I'm involved with, the NEOMET at council member for the internal medicine. There is a lot of trend for these medical students to have additional master's degree when they're graduating with their MDs. Their career path they have is master's in clinical research, or they can do an MBA, or they can do other masters. Now, there is also some talk about masters in the database management. What is your, and you have very nicely delineated the early role of the MBA with their medical school. I'm sure they are not ready to take that onus on them because they do not have a practical experience. What do you think about the conjoined program or combined program for an MBA and MD? Do you think that something would be beneficial to these students?
Yeah, that's an excellent question. And I think I'll go back to examining the reason for why anybody wants to do this kind of program. So if, say, just for sake of example, just look at MD MBA as a possible, joint program. I have looked into it from my school's perspective for a long time as well. The question I would ask the person to ask themselves is, after they do their MD MBA, are they going to be a practicing physician? Is that going to be their main job? So depending on whatever they might be, internal medicine, whatever specialty, etc. If they're going to be a practicing physician, how will this MBA help them in doing their main job? Will it really add to their qualification, skill set, and learning? Or is it something that they may need 10, 15, 20 years later if they end up running their own practice or end up in senior leadership roles? So because if they're going to be a practicing physician and that's going to be their day job, then I'm not sure if an MBA or even a master's program in management is useful, because I would rather I would rather spend that year or two of effort and money to acquire more expertise in my area so that I'm actually a better physician, because that's going to be my day job. So I think it should all be depend upon what you want to do, and does that MBA help you do your job? That should be what you should ask.
Very rightly said, Dr. Gupta. That's what we have seen in the platform when they were doing an MD PhD program. Dr. Rahman is also here, and we have one in the Cleveland Clinic, and that's exactly the combination program is an issue. I have a lot of questions. As I told you before I invited you for the lectures, these medical students are all jumping around in MBA. So they have a question. Do you have a master's in artificial intelligence?
Excellent. So in our engineering school, in biomedical engineering, of course, as probably a lot of you know, we are one of the leading biomedical groups, including AI. In the business school, actually, very few people know this. We are one of the leading business schools in the world in AI, in applications of AI in business and finance. In fact, we have several semester-long, courses there. We don't have a master's program. I don't think any business school has that yet, but elements of our AI and fintech and blockchains, etc., are very rapidly being incorporated in business education, and they should. But relatively few schools have that expertise. And I'm very proud to say the last couple of years, we have acquired some outstanding expertise in this area. And so does MIT and Stanford and a few other schools. There isn't a master's in AI yet, but there will be a master's in fintech, which is a different product. It's not for people in medical fields, but it is, AI is entering into everything we do.
Yes. I think we lost.
Any other questions?
Yeah. That's okay. Dr. Gupta, I have one more question. Sure. And this is from undergrad and also from the medical school, because we are live streaming to our graduates. They're asking, is there any way they can do like a 1 month of elective in the Weatherhead School of Management to get an idea about what this management is and does this fit their lifestyle? Now, this will be during their vacation time, because it's not approved, at least the medical school will not approve that because they have to do their co-rotation. Is there any kind of an observership or some kind of rotation they can do so they can understand whether this is what they want to do in long run?
I don't think we exactly have that right now. We have a few things which can help them. The first one is, we do several what we call as open houses. These are 90-minute or 2 hours, sometimes 3-hour events, sometimes day-long events, where we have basically people in different areas in management come and talk about management education. And these are open events. They are held year round. Right now, they are being held virtually. And those are events that, people can join and listen and learn. We do have non-degree programs and non-degree courses. Unfortunately, our summer offerings are rather slim. So most of these are during fall or the spring semester. And then they end up being you have to sort of register for a class and do it as a non-degree student. So somebody who wants to just sort of sample something, we have executive education programs, which are day-long programs and also 2-day programs. Some of them are also fairly broad exposure type programs. So as an example, there's a program which is actually in finance for those who are not in this field in finance. So it goes through some broad overview of important things in finance. Usually these are for executives with some experience in this area. So for undergrad students, exposure-wise, I would suggest the open houses and such events would be a good thing to do. And then what I've seen usually, and I get a lot of, inquiries from at random also, just contact somebody in Weatherhead, reach out to them, email them, go and talk to them. And most of us would be happy to sort of spend an hour, half an hour, and just share our thoughts on what happens in the school and if it is suitable for them.
Thank you, Dr. Gupta. I have a lot of questions, but I can see Dr. Khatri and Dr. Jain is limited with the time frame. So I'll give the platform to them. And personally, on the behalf of AIPNO executive team, BOT, we really want to thank Dr. Gupta and Dr. Rahman for giving their time to this students. Youth is what they are, will be our next generation, and giving them these insights. You have no idea how much helpful for them and how much they appreciate. And we have almost 155 participants. That's the highest among the 3 youth initiative we have. With that, I will give platform to Dr. Saloni Khatri and Dr. Vikas Chen.
Thank you, Rupesh. So this was very insightful. And I just want to thank Dr. Gupta and Dr. Rahman for taking out time to inspire and teach our youth. It's great learning experience, and even I learned a lot. And I'm sure our youth are very grateful. Dr. Rahman's primer on research opportunities sparked a lot of engagement, as we could see, and so did Dr. Gupta's guidance on path to MBA. I hope our attendees have much more clarity on these disciplines. And I want to thank all our participants, of course, for attending. One request, if I may, if you can please take a couple of minutes to give your feedback so we can improve for next time, if we are planning to arrange another series. So the feedback would be very helpful. And this can be sent to the email address. It's very simple, admin@aipno.org. So once again, it's admin@aipno.org. And I also want to thank Dr. Vikas Chen for putting everything together. And lastly, to Dr. Rupesh Rana and Dr. Dharmesh Mehta for great leadership in AIPNO. Thank you so much. Thank you, everybody. Have a good night and all the best to all our youth. Thanks.